Okay, so this right here is, we called it the bone manipulation kit. Okay, remember, this kit, you're going to use it to assist you on your implant surgeries. If at any time you need to use your electric motor, you can do so, and then you can go back and continue with the drill driver. Okay, as you know, the advantages of the drill driver is that there is no noise, there is no vibration. You can harvest all the bone and bone marrow and then reimplant it back after you finish your surgery. This kit comes in a box made out of medical grade plastic. It's autoclavable, okay, and all the tips that fit really tight in here, so nothing moves. It could be really mishandled, and it won't go anywhere. See, everything's still in place. Okay. Okay. So as we remove the lid, okay, we're going to find 10 different tips. Okay, and it comes with a handle. This is the drill driver. Okay, and as you can see, we designed the box. This is a weld, and here we have it for the sterile saline solution. So as you use your tips, you can rinse them in here, you can place them in here. Okay, so we're starting first with the bone pick. The bone pick is sharp like a needle at the tip, and it gets wider all the way to 3 millimeters in diameter, and all these tips are 15 millimeter in length, and the markings are 8 millimeters, 10 millimeters, 13 millimeters, and 15 millimeters. This is the bone pick. The next tip is the ridge split chisel. It's a very particular chisel. All chisels out there are square at the tip. This one is like an arrow, and it has a double edge, and it's sharp like a blade at the tip, and it goes all the way to 3 millimeters in diameter. So as it goes into the bone, starts spreading the bone slowly until it reaches 3 millimeters in diameter. Okay. The next set of tips are the bone expanders. The bone expander, the first one here, is 1 millimeter in diameter at the tip to 1.5 millimeters at the end. And remember, they're all 15 millimeters in length. The second expander is 1.5 at the tip and 2.5 at the very end. The third expander is 2.0 at the tip and 3.0 at the end. Number 4 expander is 2.5 at the tip and 4.0 at the very end. The next set of tips are osteotomes. These are used for the internal sinus lift. The first osteotome is 2.5 in diameter. The second is 3.0. Third, 3.7. And the fourth is 4.5. So now what we're going to do is we're going to do a surgical demonstration on the model so you can get an idea how we do work with this system. The way we start the surgery is using the pilot drill first. Okay. Remember, we're going to go right through the tissue, so we choose the spot according to the surgical stent. All right, and we start the osteotomy. Okay. Usually we go in motion back and forth and putting control pressure towards the apical area. Once you have reached the desired depth, what you want is just to loosen the driver, and we're going to leave the drill in place So we can verify the angulation, make sure you're on the right track. Okay? After you do that, then you're going to go ahead and reposition the drill into the driver, and you will remove it out of the surgical site. Any bone that you collect, you're going to save on a dap and ditch, because that's the bone that you're harvesting for grafting at the end of the surgery. What we're using here is a 2.0 drill, and you use it to go to your desired length. Okay? If at any moment you're doubting the angulation or whatever, what you do is you just loosen it up and leave your drill in place. Okay? And take an X-ray. Okay? All the bone that you harvest, you can keep it on a dap and ditch for further use. Okay, this is one way of doing it. If your bone is limited, what you do is you can start using your expanders. For example, our recommendation is the bone pick. The bone pick, remember, is like a needle at the tip, and it gets to 3 millimeters in diameter. Okay, so you can use your bone pick if the bone is relatively soft. You can use it by hand the same way you would use a drill. You go back and forth until you reach your desired depth. As you can see, we're like 13 millimeters there already. Okay, you can leave it in place the same way, or you can just remove it. After you remove it, you can continue your osteotomy. For example, we're going to use the bone expander, and this is the number 2 bone expander. Okay, at any moment you wish to know where you are, you loosen it up and you leave your bone expander in place, and you take your X-ray. Remember, you have the marking, and that tells you where the flat surface of the drill is. Always, as you instrument in the bone, try to keep at the end of the cycle, try to keep the marking towards you, so you know exactly where the flat surface of the drill is, so you can reposition the driver without any difficulties. Okay? Once it's in place, you tighten the sleeve, and then you can remove the bone expander. Okay, if you need to, you can go to your number 3 expander. Okay, and you can do your expander. Choose expander number 4, which starts at 2.5 and it goes up to 4 millimeters in diameter. Okay, so we going to do a little spreading. Okay, and I think we're just about right there. Okay, so we're ready for the placement of the implant. Okay, now you choose your implant carrier, your adapter from your company, and you just place it on the tip of the driver. Okay, you take your implant, okay, and you deliver the implant into the surgical site. Okay, okay, you use your hex driver that comes with your surgical kit, and you remove your implant mount. Okay, and you place your cover screw. Okay. This is where we go ahead and just take your bone and you graft around your implant. And put your membrane or whatever you do. Okay. We have a set of 4 osteotomes. Okay. They come from 2.5 in diameter to 4.5. So this is 2.5, this is 4.5. And they're all 15 millimeters in length, and the markings are 8, 10, 13, and 15. What's good about this osteotomes, it's not like the ones you probably have in your practice, which is a long instrument. And if you want to take an x-ray to verify the depth, because these markings do appear on the x-rays, it's very difficult with this long instrument. So with this, you tap it into place and you just leave it there and take your x-ray, and then you reposition your instrument and you retrieve the tip. Okay? So basically we have a model here. Okay, I have to see how can we go about this so you can see. You pre-drill, okay, to the, so you're a little shy of the floor of the sinus, okay, and then what you do is you tap, you start tapping until you reach the desired depth, and you start pushing your bone, and the bone will push the membrane. I don't know if you can see how you start pushing the bone, and the membrane is supposed to be there. You're supposed to be pushing the membrane away and creating like a tent effect. Okay. Then what you do, you go to your number 2, and you do the same thing. Okay. Supposedly the bone is supposed to be pretty soft. You can do it with your hand, and you can use a tap. Okay. Of course, see, you can see the bone going in there. Of course, you're going to have restriction. Okay. Okay. See, you can see the tip of the osteotome in the sinus. Okay. And you can take your X-ray and verify at any time. Of course, with this technique, the restriction, if you can fit it in the mouth to do this, you can do that. So if the sinus is like in the bicuspid area, first molar area, most of the time you can use this and you can manipulate it into place. I like to use a straight osteotome versus the angle one. Okay, and so on, and then you can place your implant as you need to. Okay, you go to your number 3 osteotome. Okay, this is like a 3.7. Okay, and it will fit there perfectly. This is sharp at the end. It cuts the bone a little bit. Okay, you go back and forth, or you can tap it, whichever you want. You see, you're cutting the bone away, and you're pushing the bone into the sinus. I don't know if you can see. Okay, but the bone chips are into the sinus. Okay, see? Okay, see the bone in there? You can take your x-ray if you want to. Okay, and let's say you want to place your implant, you get more bone. Okay, you get bone, you place it here, or you just introduce it on the osteotomy. Okay, and you can push it in there. Then you take your instrument and you take your implant, you place it into the surgical area. Okay. And that's basically what you do. From all of us at Innova Surgical Instruments, we thank you for your attention.